Hi, good morning. I'm Charles Gomez. Our next speaker is Dr. Roni Moya from Portugal. Or Brazil. Are you from Brazil or Portugal?
Brazil, and then I live in Portugal.
Okay. He does biomedical at the University of Morgi in San Paulo, specializing in anti-aging medicine in Spain. He did his Masters on Science in Molecular and Cellular Immunology and Biology at the University in Portugal. And Master of Science in Clinical Advanced Nutrition in Spain. He did his PhD in Biomedical and Immunology at Columbia University and is coordinator of Orthomolecular Medicine at Anti-Aging Intervention. He's a professor and director of graduate program in Orthomolecular Therapy. He's a scientific advisor to nutritional and cell therapy companies in Europe. He's going to talk to us on integrative therapy in oncology. It's my pleasure to introduce to you, Prof.
Thank you very much. Thank you for having me here. I'm really happy to be in Asia. My first time in Asia. It's an amazing place. Thank you very much. I'm really honored to be here. Today I'm going to speak in two parts, okay? The first part will be more introductory. I will speak about some vitamins that we can integrate with the cancer conventional therapy. And in this late evening or in the afternoon, I will speak the part 2 with other hardware to treat cancer integratively, okay? So the first time I wanna just put you to the actually definition about cancer today, okay? So the cancer is the interaction between abnormal cells that we know with the natural environment, resulting in an uncontrolled growth. What I mean with that is like we have to have a very proper environment to develop cancer. For example, acidic mucosa or inflammation. You have to trigger something to make the environment good for the cancer cells. Otherwise, they will have a very hard time to develop. So we have to start by this point. If you have a bad environment for you and a good environment for the cancer cells, then you have more facility to develop tumors. So here we have more or less what I mean with the cancer survival. They have a lot of tools to survive. The first tool would be that they thrive in a chronically inflamed microenvironment. So everybody knows that there is no pathology without any inflammation. Even Alzheimer or depression, there is always inflammation behind. So once you are chronically inflamed, the cells can develop very well in an very behavior. So the cancer cells, they will take the good environment from them, and they will develop in a very chronically inflamed environment. Afterwards, they can evade the immune recognition. This is a paradox. You have a lot of inflammation, but still you are immunosuppressed, because they have tools to immunosuppress you to not be recognized by the immune system, so they can develop easily. The third thing will be that they are very good immunosuppressors, so they can evade the recognition. They are not recognized by the immune system, and even though they will suppress you even more. So that is the problem, you know. You are inflamed, you don't have any immune system, and the cancer cells are in a good environment. They can develop very well. This is the key point of treatment, of the treatment of cancer today. So the tumors, they have a shortcome of conventional approaches. The chemotherapy, the radiotherapy, we know the conventional treatment is very limited. Why? First, because the tumors constantly mutate. To develop a pharmaceutical to attack cancer is really hard. The time that you have to develop some chemotherapeuticals, the cancer is already mutated. You know? And even if you put the chemotherapy in a patient in several sessions, the cancer can adapt to this pharmaceutical and they can change. This is the first problem. So they constantly mutate and they replicate rapidly. They understand the environment, they understand the medicines that you are taking, and then they develop over that chemotherapeutics, and they do that very rapidly. And the third thing that is the ability to repair their genetics. So we have the repairing of our DNA, but in a very chronically inflamed environment, you cannot repair so fast, but the tumors can. So they adapt, they multiply, and they are very good in repairing. This is the problem, the first shortcomings of conventional approaches. The secondly is that extremely resistant to chemotherapy. This is the problem, you know. They are all time resistant. I have patients with 30, 60 sessions of chemotherapy. They are always continue to be sick, you know. Secondly, more aggressive tumors due to the chemical resistance. Once they get resistant, they will be very aggressive afterwards. So people can die from a tumor that are resistant, from a tumor that is resistant to chemotherapy, even easily. The other part would be that they can create mechanisms to inactivate drugs. The first mechanism would be the acidic pH. So they change the pH. They make tools, very important tools, to overcome the chemotherapy. So this is the problem, guys. The chemotherapy is okay. I advise my patients to go under chemotherapy, but we have to make them better. You have to enhance their immunity. They don't have any immunity. You know, you should make something integrated to those patients, and that is not just a chemotherapy. So let's see another thing. They have a poor blood flow. So the cancer cells, they have limits to delivery of drugs in tumor targets because of their angiogenesis. They don't have veins there. You cannot deliver very well the chemotherapeutics there because there is a microenvironment. The blood flow doesn't go there. Afterwards, they progress and spread through numerous mechanisms. And chemotherapy has limited. So if the chemotherapy attack one side, they go to the other side. They go around all the time, you know. They are very intelligent cells. They want to survive. It's the basics of living being. Well, let's see how can we treat integratively patients. I'm not speaking about cure, okay? Please, we know we are doctors. We can never say about cure. You have to be the best you can to enhance the immunity, to decrease the chemotherapeutic resistance, and to facilitate the conventional treatments to get the job done. So what I do is to integrate that I explained with the conventional approach. Okay, I'm a very balanced medical doctor, so I don't say to my patients, don't go to chemotherapy, don't go to radiotherapy. I do everything together. So the first thing, it's very famous, is the vitamin C. Okay, I'm going to drive you through the science. So the vitamin C just works in high doses. Okay, the smaller doses will help the cancer to develop. Why that? Because the cancer cells can benefit from the antioxidants to get resistant to the drugs. But if you do high doses, they are not antioxidants anymore. They will be pro-oxidants, but selectively. So what the vitamin does is producing H2O2, which is pro-oxidant in tumors. And it's an antioxidant in normal cells. Let's see a little bit about the chemistry and about the articles. You see here that the vitamin C can spread to all organs, to every site. So we have reserve of ascorbic acids. So if you inject the vitamin C, you know that this vitamin C goes through all those you can treat whatever you want because the vitamin C are there. Let's see about the articles. The intravenous administration of ascorbate surpasses the joints of the intestinal wall and reaches high levels in plasma. So the intestinal absorption is really well when you do IV vitamins. When you do orally, the vitamin C doesn't do anything. But when you do IV, then it is like a chemotherapeutical, okay? So, the ascorbate at high levels, remember, high levels, can act as a drug, inducing significantly the flow of the H2O2 in tumors. And we see here that the cytotoxicity of high doses of vitamin C depends on the production of the H2O2. And to do that, you have to go on higher doses. I will explain to you afterwards the protocol, but let's see a little bit what the article says. H2O2 inhibits the production of intracellular glutathione. What is that? They can detoxify the liver, but in the tumors, they will toxify tumors because they don't have the capacity of detoxify the H2O2. You are oxidizing the tumors. High doses of vitamin C prolong survival in patients with advanced cancer, palliatively or therapeutically speaking. Okay. Other thing, let's see the precaution because there is precaution of higher doses of vitamin C, and the precaution would be the intravascular hemolysis with those patients which has the G6P deficiency, which is an enzyme. Here you can say here requires glutathione for the removal of H2O2. If you don't have, you will have oxidation, or you will be oxidated by the vitamin C. That is really complicated, guys. Do this analysis before perform the high doses of vitamin C. So, the other problem is the accumulation of calcium oxalate in the kidney with the higher dose of vitamin C. But truly, I do that for more than 10 years. And I've never seen one patient with kidney problems after the vitamin C. You have to choose the exactly good vitamin C. If you put bicarbonate inside, the bicarbonate will alkalize a little bit the vitamin C, and then you won't produce any calcium accumulation on your kidneys. Okay? I will pass the protocol afterwards. So, you can also have massive hemorrhage in rare cases of tumors, but just in terminal patients, over-drugged, and with a lot of problems together. Okay? Again, I've never seen things like that. Let's see some evidences. Okay? Studies with 50 grams, look the doses here. 50 grams, 75 grams, 100 grams, and 1.5 grams per kilo demonstrated effectiveness in death of tumors. This is from Roni Moya. They are very specialized in IVs with vitamins. I advise you to look at the publication of the Roni Clinic. They are really good to follow as protocols. Without toxicity as an adjunct to chemotherapy, so you can add the vitamin C in the same time of the chemotherapy. You must do that, you know. You will facilitate the chemotherapy because the tumors won't be so resistant to chemotherapy. With the gemcitabine, the vitamin C increases the inhibition of multiple tumors. So that I mean, together, everything integrated. The ascorbate improves the quality of life in patients with breast cancer, and during and after chemo and radio. So you can do vitamin C before, during, and after those treatments. Like for prevention, like tamoxifen for 5 years, you can also perform vitamin C during those 5 years. Of course, not so often, for example, once or twice a month, but you might do that for 5 years to help the tamoxifen don't make the patients so hard in the inhibition of the hormones, like losing hair, getting in immunosuppression, and so on. Well, the conclusion is used with the chemotherapy and radiation increases the anti-tumor potential. So, here you can see an article, very interesting article. They performed like 15 grams and 75 grams IV. And they did some studies in cells and in vivo also. Here are those studies in cells. Those are those cells that are in tumor lines, okay? okay? Every time that you enhance the quantity, the amount, the doses of the vitamin C, the cells go down. But pay attention, until here, they are the same. This is the physiologic vitamin C. So if you give patients like 1 gram or 5 grams or even 10 grams orally, you won't do anything. May be harmful to tumors, to the patient, not to tumors, okay? But once you increase the dose of vitamin C, then you get the response. And here you can see the same thing by the cytolytic cancer and the ascorbate cancer, okay? When you add the ascorbic acid, the cells go down, but depending on the doses every time. So here, I will integrate the treatment of the vitamin C with the alpha lipoic acid. So just to remember you, normally I do like once or twice a week the vitamin C infusions. Afterwards, I will give you the protocol. Normally, you can give every day the vitamin C, but I live in Portugal. People are poor, they cannot pay, you know, and the government doesn't pay the vitamin C. Even if it's very, very cheap, they don't pay. So I have to handle a little bit the money thing. So I give the patients twice a week vitamin C or once a week vitamin C, depending on their money. So to enhance the possibility to get a better response, I integrate other antioxidants, and one of them is the alpha lipoic acid. So as you hear, there are some mini reviews about the alpha lipoic in cancer therapy, and mainly in leukemia cells. But normally, in general, what the alpha lipoic acid does is to inhibit the ATP of tumors. So if they don't have any energy, if the mitochondria is not functioning, the tumors go down. Okay? So here we see that the alpha lipoic acid is a chelator, good for metals. It is an inhibitor of free radicals, but with higher doses, we'll do the same as the vitamin C in tumors, okay? So let's see here. It inhibits the energy metabolism in leukemia cells selectively, not in normal cells. I don't know the mechanisms. I'm going down the deep science, but still I don't recognize the real mechanism for that. But well, they publish good results, but not so good mechanisms behind. The toxic in leukemia cells, they are very selective and antioxidant in normal cells. And this is the thing, you know, they have to increase the doses. And once you increase the doses, then you go under apoptosis of the tumors because of the decreasement of the ATP. Here you have their supplementation in healthy cells under oxidative stress, repair natural and mitochondrial function. So if you have a good cell under stress, because the cancer is a stressful situation, if your cells, normal cells, are under stress, the alpha lipoic acid will act as an antioxidant, protecting those cells. But in tumors, it will decrease the ATP because it works aberrantly in the mitochondria of the tumors. You can see here the differentiated cells, normal cells, and the transformed cells, tumor cells. And you can see here that the tumor cells will decrease once you increase the doses of the alpha lipoic acid. This I prefer to do those IVs first because it happens to be more actively, and secondly because you won't destroy the intestine of your patients with those higher doses, you know. Here you can see also the same thing, a lot of cell lines. This is the T cells, so doesn't have anything with the T cells, but with the other cells that are cancer cells, you go down as much as you increase the concentration of lipoic acid. The lipoic acid has different effects on the metabolism of normal and transformed cells. Those are the results of the article. Once you increase the dose, the lipoic acid affects the level of ATP production and by then induces apoptosis. So it affects the metabolism of normal cells in a good way, but in a cancer way, it will really take them to apoptosis. Okay, what I do, the method, okay? I do like that, IV daily, or twice a week. Daily would be theoretical. If you have good patients that can pay that, you can do every day the IV with alpha-lipoic acid, okay? I'm a honest, I try to be the honest as I can. So in my clinic, the patient, they don't have so much money. I'm not those fancy doctors from Hollywood, I'm from Brazil and then afterwards to Portugal. So I do twice a week, and I increase the dose to 1200 milligrams. Okay, this is the doses that I use. The 600 milligrams would be for more or less more than 4 times a week. And it's synergic with the vitamin C, glutathione that I will speak afterwards, and B complex. Remembering the B complex are cofactors of every biochemical reaction. So you have to integrate the B complex, otherwise the other antioxidants won't work very well. Okay. Speaking about glutathione, the indication would be the chemotherapy patients, okay? You know that the glutathione is a very detox antioxidant, so you can do with a lot of chemotherapeuticals. There is no problem, there is no side effects, there is no bad integration with the chemotherapeutics. You can make people, you can treat people under radiotherapy because they go to liver intoxication during radiotherapy, and the glutathione will detoxify mainly the second phase of the liver detox procedure. So here is the glutathione and all those chemicals behind, and when you add the chemotherapeutical here, you toxify the liver phase 2. Remember, the phase 1, the fat goes to aldehyde, and the phase 2, the alcohol turns up to be water. That phase 2 is very important to go from alcohol to water, and the glutathione is the key point amino acid to do that. So once you put the chemotherapeutics here and you enhance the glutathione, you will go under a very good excretion of those chemicals, and you won't intoxify the patients. So here you see the pathways, okay, making water. And the glutathione is in the phase 2 and mediated the detoxification of cancer chemotherapeutics. Alright, so what I do? The same. Because I put everything together. I put glutathione, alpha-lipoic acid, and vitamin C in the same IV. So what I do is 600 milligrams with the glutathione. And I do synergically with the vitamin C, alpha-lipoic acid, and B complex. So this is a nutrition therapy. The patient comes to my clinic, in 1 hour takes the IV with like 50 grams of vitamin C, 1200 alpha-lipoic acid, and 600 of glutathione. This is the protocol, you know. You can do once a week, twice a week, or every day, depending on the money of the patient. Unfortunately, I have to speak about money because I'm not in the public hospital. So, to integrate a little bit more the good IV, the last but not least, I will speak about the selenite. You know that the selenite is very important for the thyroid, but even more important for the T cells. The TCD4 depend on the selenium to activate all their factors, to enhance the recognition of the immune system to the cancer cells. So here you see that the indication of the selenite would be for the cancer prevention, patients, for example, under tamoxifen, reduction of cancer progression, and an immunomodulator. I go more to this part here, okay, because the selenium is a factor, is a very important cofactor for activating the T cells. So, we have here the indication for the reduction of the side effects of cancer treatments, normally by intoxication. Selenite is also with the glutathione a very good detoxifying product. So for example, nausea, vomiting, loss of appetite, infections, do chemotherapy and everything, selenite is very important. And at the doses that I pass to you won't be any side effects. So it's a very good antioxidant because it activates glutathione. So it detoxifies the carcinogens through its upregulation of the nuclear receptor factor 2, which is a very important transcriptor factor for the antioxidant mechanism. So it enhances our antioxidant response, and attacks the cancer because it activates the T cells. Okay, this is the thing. So normally we can do like that for tumor surgery, for example, the IV before and after surgery for 2 days. So the patient gets 2 days before, then he has the surgery. Once he's recovered by the surgery, he can do 2 days afterwards. Okay, the doses would be 300 micrograms for that. And IV on the surgery day would be 900 micrograms. But this is more theoretical, but because it's not so easy to do the selenite in the same day of the surgery, because not every hospital can do that, okay? It
How long more would you take?
Sorry?
How long more would you take?
Okay, I will finish now, it's the last one. So, you can also do the chemotherapy, so IV 2 days before and during chemo, but the doses has to be increased, like for 900 micrograms. And you can decrease the doses at the day of chemo. So, take home lesson to finish on time, okay? Vitamin C on higher doses, together with alpha-lipoic acid, glutathione, selenites, and others that I will speak about this afternoon, okay? Artesunate, B70 vitamins, DCA, I will speak about everything tonight. And they may benefit and support the best anti-cancer protocols, and they are very synergically without any bad side effects. So, if you want to contact me, I'm here in Italy or in Portugal or in Spain or in Asia. Very happy to answer any question. Thank you very much for having me here. Thank you. Any question? Doctor?
Roni, thank you so much for your passion and intensity. It's really infectious. I just want to ask you a little bit about what actually kills. We don't know what kills cancer cells, because even it's free radicals. And I'm wondering if there are clinical trials showing that glutathione is actually beneficial. I get what you're saying about increasing the detoxification. That sounds nice.
Okay.
But if you ramping up the antioxidants with glutathione and selenium, is that going to be beneficial in terms of killing cancer cells?
No, it won't. Honestly, it won't. The thing is to do everything synergically. First, you have to think about nutrition. You have to change the environment for the benefit of the patient. Secondly, you have to make sure what kind of chemotherapy they are under, or surgery, or whatever. Then the selenite and the glutathione would be just an adjuvant, not the main key chemotherapeutic or natural chemotherapeutic thing. They just help to detoxify, to make life better, enhance the quality of life as they are detoxification products. But the one thing that I like is to add to the vitamin C, because the glutathione can increase the response of the vitamin C, and there are a lot of publication about that. But the glutathione alone just is a detoxification product to make the patient feel better, to not have nausea, to not decrease energy. They say to me, Roni, I'm not feeling bad about my chemotherapy. I'm going through chemotherapy very well. I can do my exercise, I can eat well. That is the main thing. Once the patient can eat well and they can go under exercise and they can have a normal life, they can enhance their immunity by themselves. So what I do is just help the patients to get a good immune system, nothing else.
So you mentioned about vitamin C intracellular in the
Intravenous.
That is pro-oxidant.
No, I mentioned that in the normal cells they are antioxidants, okay?
Yes, but in cancer cells it's pro-oxidant.
Pro-oxidant.
How about glutathione in high dose?
Yeah.
What happens to the cancer cells? Are they pro-oxidant or antioxidant?
Okay, in the higher doses of glutathione, you just activate a lot of the detoxification processes, but it's not so good that, because then you detoxify very fast the chemotherapeuticals. So, as I showed you, I didn't put so higher doses of glutathione. I put a 600 milligrams, that is not so high, just to make an adjuvant to the vitamin C. Okay? The glutathione alone in a higher doses just will make the patient detoxify faster the chemotherapeuticals, and that I don't want. I want the chemotherapeutic to function, but not to make the patient harmful after chemotherapy. You know, that will be just the integrative protocol. Of course, if you do just the glutathione in higher doses, there are some publications that say that the cell lines go under because the same process of the vitamin C. But I cannot make you make sure of that because I am I'm a science guy and I don't recognize the mechanisms until I don't see the good articles published. Okay?
Do you give the dosage to children with leukemia based on the body weight or?
Yeah, I do based on the body and the body weight and depending on the age and depending on the other medicines they are taking also because the intestine can be very switched off, the absorption would be very hard. I have to treat them with probiotics. There are some other things that I have to give orally, you know, like curcumin I can do also orally. I have to organize the food. That is not the main treatment. It's one of all global treatment of the cancer therapy.
The question is your protocol still indicated efficient in palliative phase?
Yeah, better.
When there is no chemotherapy?
Yeah, it's better. It's better to that, you know. I would prefer to make this protocol for the preventive treatment or for the palliative treatment. Even though because the glutathione alpha lipoic acid, they will take off those symptoms, you know, those symptoms of vomit, nausea, headaches, bad feeling, bad energy. That would be perfectly better than treat people during the cancer therapy. That would be the best way to treat patients in palliative way.
But in this particular condition, do you expect also stabilize the
Yeah. Stabilize and maybe if I'm lucky, decrease the tumors. If I'm lucky, I won't say that the tumors can be decreased. There are publications of that. I saw patients under remission, but I cannot make sure that the remission was because of the vitamin C. I just have a patient now with lymphoma, very rare. There is no chemotherapy for her, and she didn't want to be treated in a normal hospital. So I'm doing this, but with the GCMAF also. Okay, so there is integrative treatments with those kind of patients, and she had 4 lymphomas, now she has 1. And she doesn't do any chemotherapy, just that.
Thanks, Prof.
Thank you very much, guys. Bye-bye.
Thank you. Our next speaker is Dr. Pen Rizal. She specializes in psychosomatic medicine and psychotherapy, homeopathy, emotional code, and body code, and is a body code practitioner. She studied medicine at the Hamburg University, Germany, and after graduation she undertook